and I'm Wendy, and I'm going to be your physical therapist today.
Hi.
What we're going to be doing today is testing the sensation of your arms. This is what sharp is going to feel like.
Okay.
And this is what dull is going to feel like. Okay? And I'll have you move your, there you go, thank you. And again, I'm only going to test your left arm for demonstration purposes. And again, just say sharp or dull.
Okay.
And have you close your eyes for me?
Sure. Sure. Dull. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, good.
During the sensory examination, you'll test many types of sensation, including light touch using a cotton swab, temperature using the large cold metal end of your tuning fork, pain using the sharp end of a broken cotton swab or pin, vibration using a 128 Hz tuning fork, proprioception by moving the ends of digits, graphesthesia by drawing numbers and shapes on the patient's palm, stereognosis by having the patient identify a common object placed in the hand, double simultaneous stimulation using light touch, and balance using the Romberg test. When testing each sensory component, have patients close their eyes so they can't use visual clues to identify the stimulus. Each of the components, except for balance, are tested bilaterally so that one side serves as a control for the other. To assess light touch, gently stroke the patient's skin with a cotton swab. First, demonstrate what you will do before asking the patient to shut her eyes. Say, "This is how a light touch feels. I'll touch you while your eyes are closed, and every time you feel me touch you, say yes, okay?" Have the patient close her eyes. Stroke the cotton swab in the distribution of the different cutaneous nerves of one arm.
What about here?
Yes.
And here?
Yes.
Here?
Yes.
And here?
Yes.
Remind the patient to say yes with each touch she feels.
Do you feel this like a light touch?
Yes.
And here?
Yes.
Okay.
Repeat the examination in the same areas on the other arm.
Yes.
Okay. Here?
Yes.
And here?
Yes.
Here?
Yes.
And here?
Yes.
Next, stroke the same location on each arm, asking the patient to say whether both sides feel the same or different. Follow the same procedure on the lower extremities.
Yes.
Stroke the cotton swab in the distribution of the different cutaneous nerves of one leg. Remind the patient to say yes with each touch she feels.
And here?
Yes.
Do you feel this?
Yes.
And here?
Yes.
Repeat the examination in the same areas on the other leg.
Yes.
Over here?
Yes.
And here?
Yes.
Do you feel this?
Yes.
And here?
Yes.
And here?
Yes.
If any area seems to have decreased or abnormal sensation, do a more detailed test of that area. To assess temperature sensation, touch the patient's skin with something noticeably hot or cold. Many clinicians use the large end of a metal tuning fork, which feels cold. First, demonstrate what you'll do before asking the patient to shut her eyes. Say, "This is how cold feels. I'll touch you while your eyes are closed, and if the object feels cold, say, cold, okay?" Have the patient close her eyes. Touch the cold object to one arm in the distribution of the different cutaneous nerves.
Cold. Cold.
Remind the patient to say cold with each touch that feels cold.
Cold.
Repeat the examination in the same areas on the other arm.
Cold. 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 Cold.
Next, touch the same location on each arm, asking the patient to say whether both sides feel the same or different.
And does this feel about the same as that?
Yes.
Okay.
Now, touch a distal location and slide the cold object proximally. Ask the patient whether the intensity of the cold sensation changes. Test both arms. Follow the same procedure on the lower extremities. Touch the cold object to one leg in the distribution of the different cutaneous nerves.
Cold. Cold.
Remind the patient to say cold with each touch that feels cold.
Cold.
Okay.
Repeat the examination in the same areas on the other leg.
Cold. 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 Cold.
Next, touch the same location on each leg, asking the patient to say whether both sides feel the same or different.
Same.
Here versus here.
The same.
Now touch a distal location and slide the cold object proximally. Ask the patient whether the intensity of the cold sensation changes. Test both legs. To assess pain sensation, touch the patient's skin with a sharp object, such as a pin or the broken end of a cotton swab. Discard the object after use to prevent transmission of infection.
I'm going to be
First,
testing,
demonstrate what you'll do before asking the patient to shut her eyes.
feel sharp.
Say, "This is how sharp feels. I'll touch you while your eyes are closed, and if the object feels sharp, say yes, okay?"
Okay.
Touch the sharp object to one arm in the distribution of the different cutaneous
Yes.
nerves. Remind the
Yes.
patient to say yes with each
Yes.
touch that feels sharp.
Yes. 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 Yes.
Okay. A little more to the other
Repeat the
side.
examination in the same areas on the other arm.
Yes.
Sharp.
Yes.
Sharp.
Yes. 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 Yes.
Next, touch the same location on each arm, asking the patient to say whether both sides feel the same or different. Repeat this in several locations. Now touch the arm circumferentially. Ask the patient whether the intensity of the sharp sensation changes. Test both arms. Finally, touch a distal location and move proximally. Ask the patient whether the intensity of the sharp sensation changes. Test both arms. Follow the same procedure on the lower extremities. Touch the sharp object to one leg in the distribution of the different cutaneous nerves.
Yes.
Sharp.
Yes.
Sharp.
Yes.
Remind the patient to say yes with each touch that feels sharp.
Leg now. Let's feel
Repeat the examination in the same areas on the other leg.
Yes.
sharp.
Yes. Yes.
Here.
Yes.
Sharp
Yes.
and sharp.
Yes.
Okay. Sides. Does this?
Next, touch the same location on each leg, asking the patient to say whether both sides feel the same or different.
Does this feel?
Repeat this in several locations.
Now
Now touch the legs circumferentially.
feel this.
Ask the patient whether the intensity of the sharp
Yes.
sensation changes.
And on this leg, do you feel it all the way around?
Yes.
Same sharp.
Yes. The same.
Finally, touch a distal location and move proximally. Ask the patient whether the intensity of the sharp sensation changes.
Feel the same sharp all the way?
The same.
Okay.
Test both legs.
The same.
Same.
To assess vibration sensation, touch a vibrating 128 Hz tuning fork to selected distal bony prominences. Tap the tuning fork firmly against your thenar eminence to make it vibrate. Demonstrate the sensation of a vibrating fork, and then dampen the vibrations and demonstrate that sensation. Now have the patient close her eyes. Touch the interphalangeal joint of each
Yes.
thumb with both a vibrating and non-vibrating fork.
No. Yes.
With each touch, ask the patient whether she feels vibration or not.
Yes. No. Yes.
Okay.
Follow the same procedure on the lower extremities.
Feel this?
Yes.
Test over the medial malleoli.
And now?
No.
And now?
Yes.
Okay. What about on this side?
Yes.
Okay. And now?
No.
And now?
Yes.
Okay.
And over the interphalangeal joint of the big toes.
Yes.
Okay.
Again, switch between a vibrating and a non-vibrating fork.
And here?
Yes.
Okay. What about Here.
Yes.
Okay.
No. Yes.
Okay.
Finally, apply the vibrating fork to the joint of each big toe and ask the patient whether the intensity of the sensation
Yes.
is the same. To assess proprioception, move the distal phalanges of the thumbs and big toes up and down and ask the patient which direction you moved them. Be sure to grasp the digits from the side so the patient cannot use pressure sensation to tell the direction. And before you move the joint, wiggle it slightly to mask the
Down.
starting location.
Up. Up.
Have the patient close her eyes and test one thumb and then the other.
The other side.
Each time you move the joint, ask her whether it is up or down.
Down. Down. Down. Up.
Follow the same procedure on the big toes.
Down. Down. Up. Down. Down.
Okay. Other side.
Down. Up. Up. Down. Down.
Assess graphesthesia by asking the patient to close her eyes and recognize by feel numbers, letters, and/or shapes you draw on her palm with a blunt-tipped object. Each time, ask her what you drew. Here is number 3,
3.
Okay.
0,
0.
8,
8.
a triangle,
Shapes.
Triangle.
and a square.
Square.
Repeat the exam on the other hand. Assess stereognosis by asking the patient to recognize by feel some common objects you place in her hand. Allow her to manipulate the object to feel it with her fingertips. Have the patient close her eyes and identify each object that you place in her hand. Here's a paper clip,
It's a paper clip.
a key,
It's a key.
and a coin.
It's a coin.
Assess the patient's response to bilateral light touch stimulation on her arms and legs.
Close your eyes for me.
Have the
Very
patient
much.
close her eyes and ask her to state whether you are touching her on the left,
Now.
right, or both.
Left.
And now.
Both.
First, touch each arm individually to ensure that the
Right.
patient can feel both sides.
Left.
Then touch both
Left.
sides simultaneously using equal pressure.
Both.
If she answers right or left rather than both, called double simultaneous extinction, her sensation is probably abnormal at the cortical level.
Okay.
Repeat the test on the legs.
Where'd I touch?
Left. Right. Right. Both.
Now, this is check your vibratory senses. This is vibrating, and this is not. I want you to tell me if you feel it vibrating each time. Close your eyes. Okay. Yeah. Yes. 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 Yeah. Okay. Now I'm gonna check your soft sense. This is what it feels like. Soft. Just tell me every time you feel it. Can you close your eyes? Yep. 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 Yes. Yes. Yep. 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 Okay. Now this is sharp, and this is dull. I'm gonna you to tell me whether you feel sharp or dull. Dull, dull, sharp, dull, sharp, dull, sharp, dull, sharp, sharp. Okay. Now I'm going to check your stereognosis. Can you close your eyes and tell me what I'm putting in your hand? Quarter. Good.
Okay, now we're gonna do the sharp test.
Okay.
And what I'm going to do is I'm going to touch you on the skin with this end of the reflex hammer, and you'll tell me when you feel it. I'm going to have you close your eyes.
Okay.
Okay.
Now. 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 Feel it. Yes. Now. 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 Now.
Okay, now I'm going to do the same thing, but the other end of this hammer, okay?
Okay. Now. 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 Now.
Okay. Perfect.
Okay.
Hi Julie, I'm Guillaume, I'm a student in Physiotech at Dawson, and I'm here to do a sensory test on you.
Okay.
So I'm going to start with the light touch test. So I'm going to touch both of your arms or leg with these, and you tell me if you feel the same on both sides, okay?
Yeah.
So close your eyes.
Same. 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 Same.
Alright. Now I'm going to do the sharp or dull test. So I'm going to touch you with the sharp side or the dull side. Okay, this is dull and this is sharp. Okay,
Okay.
so you tell me what you feel.
Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Dull. 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 Dull.
Okay. And we're gonna finish with the temperature test. So this one is hot, this one is cold. I'm gonna touch you and you say if it's hot or cold. Okay, so this is hot and this is cold.
Okay.
Alright? So let's go.
Hot. Hot. Cold. Cold. Hot. Cold. Cold. Hot. 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 Cold. 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 Hot. 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 Cold. Cold. Hot. Hot. Cold.
Alright.
Now I'm going to check your touch sensation, okay? So let's have a feel first here. Can you feel it?
Yeah.
Did it feel soft?
Yeah.
Okay. So I'm going to touch you at several points. So as soon as you feel, let me know by saying yes, okay?
Okay.
And if you could put your arms out like this way, excellent. Close your eyes, please.
Yes.
And did it feel same on both sides?
Slightly less on the right than the left.
Okay.
Yeah.
Did it feel same?
Again, slightly left on the right. Less on the right than the left.
Okay.
Yeah. Yes.
Do you feel same?
Slightly less on the right than the
1
left.
minute remaining.
Yes.
1 minute more.
Yes. Yes.
So do you always feel less on the right
Less
side?
on the right.
Okay, that's fine. Now I'm going to check your pain sensation. So it shouldn't hurt you. How do you feel? Do you feel sharp?
Yeah, sharp.
Close your eyes, please, and let me know when you can feel it.
Okay. I felt something then.
Do you feel same on both sides?
No, the left is sharp, the right isn't.
Right.
Yeah, but it wasn't sharp. Again, the left was sharp, the right wasn't.
What about now?
The left was sharp, but the right wasn't.
Okay.
Mm.
Right. So it's a bit less on the right side. Is that right? Yeah. You can
Yeah.
open your eyes now. Can you feel it vibrating? Not the touch, but the vibration?
Yeah.
Okay. Right.
Stop.
The next of our superficial sensation testing will be pain sensation testing, also known as sharp dull discrimination. Now, for testing purposes today, I'm going to use the tip of the reflex hammer that has a little pin, so you can use the one tip for sharp and the other tip for dull. You can also use a paper clip or, of course, a safety pin. Now keep in mind you are poking your patient with something sharp. So not only do you want to clean any apparatus applied to your patient's skin, but you want to be mindful and be gentle with the sharp ends. So actually what we're going to be doing for pressure purposes is keeping our pressure on the pin. One way to maintain consistency of pressure is to keep the pressure light enough that your fingers can actually slide down the pin when you are applying the sharp pressure. So as applied to a patient, you of course educate your patient what she will feel. We're going to demonstrate on the uninvolved extremity. For the sharp end, I'm going to maintain enough, the pressure light enough that my fingers can slide down there, but you do not want your fingers to make contact with the patient's skin because that is applying an abnormal tactile sensation and could mar the findings of the test. So what we're going to do is just slide down about to there. So what you'll be feeling, Miss Smith, we're going to be applying a dull pressure. You identify when I put pressure as either dull or sharp.
Okay.
We okay?
Okay.
The dull end, you do not want to create a cavern in your patient's flesh, just enough pressure to dent the skin. Okay? So this is what I'll be doing on your involved extremity.
Okay.
We always want to prop up, as previously noted, clear the area. We're treating in with superficial sensation testing. We are treating in dermatomal and or cutaneous nerve pathways. Never forget to have your patient close the eyes. If you do forget or the patient instinctively does so, you must identify that you have asked your patient to close eyes before the sensation testing begins. All right, please close your eyes for me. All right, how about here? Is that sharp or dull?
Dull.
And here?
Dull.
Here?
Sharp.
How
Sharp.
about now? And again?
I didn't get that one.
And now?
Dull. Sharp. Sharp.
And here?
Sharp.
Here?
Dull. Sharp. 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 Dull.
Thank you. Notice that in the areas that indicated a potential impairment in sensation to distinguish between sharp dull, we tested an extra 2 times in each area where she indicated an improper response to the test, just to be sure it wasn't tester area error or to determine whether there really was an impairment in sensory feedback. Thank you, ma'am.
You're welcome.
And what I'd like to do is, when I touch you with this cotton swab here, we're going to do a little test run, and I just want you to tell me where it is, so that way I know that you can feel it, okay?
Sure.
Okay, perfect. So,
Top of my left shoulder.
okay.
Top of my right shoulder.
Good. So we're going to do the same thing this time, but I want you to close your eyes. Okay? C4.
Top of my left shoulder. Top of my right shoulder.
C5.
Left lateral shoulder. Right lateral shoulder.
Good. And then if you can just put your hands on your legs for me. Good. C6.
Left thumb. Right thumb, sorry.
Good.
Left middle finger.
Good. C7.
Right middle finger.
Good.
Left pinky.
C8.
Right pinky.
Good. Okay. And then if you want to just turn your hands over for me.
Left thumb.
Good.
Left middle finger. Left pinky. Right thumb. Right middle finger. Right pinky.
Good. Okay. And then just go ahead and put your hands on the table for me. Now we're looking at L2.
Right thigh. Left thigh.
Good. L4.
Right lower leg.
Good.
Left lower leg.
L5.
Left top of foot. Right top of foot.
Good. I don't remember, look at S1.
Left side of foot.
Good.
Right side of foot.
Good. Good job, Hannah. So everything seems to be normal. That's great. Seems like everything's working well. Do you have any questions for me? All right. Perfect, Hannah. Thank you so much.
Yeah.
All right.
Okay, so now we're going to be looking at sharp dull, and we're going to be focused on the hand for this. Just kind of to orient you to this diagram, this is what we'll be using us to guide us in where we test. So you can see here, spots 1, 2, and 3 are used to test the ulnar side of the hand. 5 and 6 are used to test the median side of the hand. 4 is used to test the radial side of the hand, but what you want to be careful of in this picture, it looks like it's kind of in the medial part of the palm, but for it to truly test the radial side of the hand, you need to be more on this lateral side. Okay, and I'll show you that when we test also. The other part of the picture is here, number 7. This is the dorsal side of the hand, again along the thumb. Sorry about that. This will also be used to test the radial side of the hand. In terms of setup, you'll see that I've got her on putty, and what we're doing is we're placing her hand on a more secure surface so that when we test sharp dull, she's able to focus on the sensation of sharp and dull and not on the movement of her hand. So this stabilizes her hand so that she doesn't sense movement. If I just support her hand here and say I was testing light touch and I pushed on her finger, if I moved her finger at all, she's not only receiving information about light touch, she's also receiving sensation about movement. So we want to eliminate movement, and we do that by placing them on putty. When you test sharp dull, you can test with paper clips. You can use a paper clip if this one was still bent in its normal curled up position. You could use the bent rounded position for dull and the unbent position for sharp, which is also used to test pain. The other option is to use a safety pin. Okay, so again, this rounded portion being for dull and the pointed end being for sharp or pain. But obviously, if you pull this out with a patient, you're going to make them a little bit nervous. So it's really important for you as a clinician to explain what you're doing and why you're doing it. I would also recommend that you test it on yourself so that you know what it feels like and you know how much pressure to give. So for my patient here, I'm going to use a safety pin, and it's just to see how well you're able to distinguish sharp from dull in your hand. What I'm gonna do is this soft side is going to be used for dull, and I'll show you on myself here. I'm just going to be pushing on different places of your hand. Okay, versus the sharp end here. I'm going to just push a little bit. It's not meant to be hard. It's not meant to cause true pain or, of course, draw any blood. I don't want to do that either. So I want you to experience that first with your hand that doesn't have any deficits and with your eyes open so you know what to expect.
Okay.
This, and I'm going to switch hands here. This is obviously the dull side. Okay, so you kind of get an idea of what that feels like. And then for the sharp side, this is what this feels like. Okay, was that okay?
Mm-hmm.
Okay, so now you can kind of see the difference also between sharp and dull.
Right.
So we're going to do that for this hand. So when we're testing sensation, we're asking the patient to close their eyes. Some people are unable to keep their eyes closed for the duration of the test, and so what you might consider also is putting a sheet up in front of their face just to block their view of their hand so the test isn't skewed by their vision. I trust my patient though that she can keep her eyes closed, so I'm going to just now at this point I'm going to have you close your eyes, and I want you to tell me when you feel either sharp or dull.
Okay.
And I'm going to use my paper to just help guide me on where to test. Okay, so here we go.
Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull.
Now, for the purposes of instruction, I'm going to tell you guys that make sure when we do test the radial side of the hand that we really come out to the lateral side of the thumb when you're testing the volar side, so that you can make sure you're capturing radial sensation and not median sensation. So I'm going to start testing again.
Dull. Sharp. Dull.
Okay, and now I'm going to ask you to flip your hand over. Okay, eyes are closed again.
Dull. Dull. Sharp.
Okay, and relax. You can open your eyes. So one thing you may have noticed again during this testing is you try and vary your speed so that they don't get used to responding in a timely manner. So don't hesitate to take pauses. Don't hesitate to repeat a test if you're unsure or if the client is unsure. That is okay also.
Okay, now in this video, what we're going to look at is sharp dull sensation. The item you will need to test is an actual safety pin. You can also, if necessary, like if you don't have safety pins in your clinic, you can use a paper clip and just kind of distort it a little bit. So what I always do, and of course I'm not going to do it, so I'm hoping I'm not transmitting any disease. I always sterilize my safety pin with an alcohol swab before I use it because you never know where that safety pin's been. And then of course you really have to explain this one to the client because they always think you're coming after them with a pin, you're going to draw blood, and that's not the case here. So for the purpose of this test, I just want to see how you're sensing sharp dull. And the reason for that is, let's say you're up walking around and brush against something that is like a sharp edge. I want to know that you can sense that so you're like able to do like a quick skin check and know if you cut yourself. Okay? All right, so I'm going to use the safety pin. And basically what you're going to feel, and I'll do it on myself first so you know I'm not going to be this masochistic therapist today. Basically, I'll use this end for dull, this end for sharp. Okay? So you'll feel a pointy edge. Again, you'll test per less affected side first. You're still going to follow that proximal to distal pattern, and you're going to again do that random like we were doing with the thermal sensation. So again, close your eyes and just let me know if you feel sharp or dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sorry, I got that. Sorry. Yeah. Okay, we're done. Oh, well, no. So for that, obviously she was 100% intact. You would again do the same like you've been doing for the rest of the sensory test. Intact, impaired, or absent is how you would document that. And what I really haven't mentioned, but what's probably good to mention, is if it were impaired or absent, kind of defining where that might be. If it's following a particular dermatome, where they're impaired or absent, and what dermatome that is. All right, that is it for sharp dull.
We're going to introduce the sensations to the patient, and then we're going to throw in an objectifying portion to where we can objectify the sensory exam. I'm going to show you, this is light touch. Do you feel that?
Yes.
Okay. And this is sharp. Do you feel the differences?
Yes.
Okay, what I want you to do is I want you to point to where I touch you and tell me what it is. Close your eyes.
Soft. Sharp. Sharp. Light.
Good. Now that objectifies our sensory exam. Now we'll go right into our sensory exam. I'm going to touch you with the light cotton, and I want you to compare side to side. Does this feel about the same as here?
Yes.
Does this feel the same as this?
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 Yes.
The medial side of the foot, does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Top of the foot, does this feel the same as this?
Yes.
And maybe turn around. Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
And the lateral feet, does this feel the same as this?
Yes.
Good. Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
With S3 and 4, I'm going to touch on the buttocks. Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Perianal area would be done if there's a suspicion of cauda eguina. Now I'm going to turn back around. We're going to do the same thing with the pin prick. Does this feel the same as this?
Yes.
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 This feel the same as this?
Yes.
This feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Does this, the feet, feel the same as this?
Yes.
Okay, maybe turn around. Does this feel the same as this?
Yes.
This feel the same as this?
Yes.
And the lateral feet, does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
This feel the same as this?
Yes.
And for S3 and 4 again, does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Good. Now maybe turn back around. Now for the posterior column evaluation, I'm going to have you spread your legs out just a little bit. Keep the eyes closed. You feel me touching you?
Yes.
What do you feel?
Vibrations.
Good. Okay. Do you feel me touching you there?
Yes. Vibrations.
Good. Okay, now, if the patient does not feel vibration at the ankles, I'm going to want to move up the leg to see where they may feel vibration. So, if they do not feel it at the ankle, I will then again strike it and move up the shin and place it, and I ask, do you feel that?
Yes.
What do you feel?
Vibrations.
And I'd do it on the other side. If there was a deficit at the ankle, do you feel that?
Yes.
What do you feel?
Vibrations.
Good. And this is a good way to evaluate for polyneuropathies and whether or not they are improving or getting worse.
This next test, I'm going to take the this caliper, and I'm going to touch 1 point or 2 points, And I want you to close your eyes and tell me whether I'm touching with 1 or 2.
1, 2, 1,
Good,
2,
good. Now we do it up on the palm. 1 or 2.
1, 2, 2, 1.
Now we're going to test over here. 1 or 2.
1,
Good,
2, 1,
good,
2,
good.
1, 2,
Good.
1, 2.
Very good.
So what I want you to do is position yourself like this.
Like that?
Yes, good. And well, first we're just gonna do a couple practice ones.
Okay.
Okay. And tell me when you feel this. I'm gonna touch you with this cotton swab and tell me when you feel it.
Okay. Yes. Yes.
Good. Okay. So now what I want you to do is close your eyes so that we can really rely on what you're feeling and not what you're seeing. If you're seeing where I touch you, it's less reliable.
Okay. So close my eyes the whole time.
Yes. And when I touch you, say yes.
All right.
Okay.
Yes.
C4.
Yes.
C5.
Yes.
C6.
Yes.
C8.
Yes.
T1.
Yes.
C4.
Yes.
C5.
Yes.
C6.
Yes.
C8.
Yes.
T1.
Yes.
L2.
Yes.
L2.
Yes.
L4.
Yes.
L4.
Yes.
L5.
Yes.
L5.
Yes.
S1.
Yes.
S1. Good. You can open your eyes. Okay. So I would say that your nerves are intact. Your response is intact.
Okay. Good.
This is Dr. Lanceris from 360woundcare.com, and today we're going to be doing yet another in the series of neurologic examinations of the foot. This is yet another simple, easy to perform point of care test. This is for sensation of pinprick. On the diabetic foot, we have 3 dermatomes that we can test: the L4, L5, and S1 on the lateral side of the foot over the 5th toe. The test is very simple and easy to perform using a disposable pin. You don't want to reuse these. You're going to apply very light pressure to the dorsal surface of the toe just below the nail. Just enough to deform the skin but not draw blood. So this will be testing the L4. Then you can come to the 2nd or 3rd toe, testing L5, and then to the 5th toe, testing S1. The test is performed initially either on the patient's arm or hand so that they can understand the sensation of what the pinprick feels like. Once they get that sensation understood, then what you have them do is close their eyes and then perform the test. A positive test is going to be a test in which the patient does not feel the sensation of the pinprick. This is going to again be repeated on the L4, L5, and S1 distributions, looking for loss of protective sensation.
I want you to put your hands out for me, and I'm going to do this on your hands and your feet. And close your eyes and tell me if you're feeling a vibration or just pressure.
Vibration. Vibration. Pressure. Pressure. Vibration. Pressure. Pressure.
Okay. Good. And now I'm going to test your body sensing. So I'm done with your hands, and can you just close your eyes and then move your big toe around a lot? And I want you to tell me if I'm if it's in an up position or a down position. Okay.
Up. Down. Down. Up.
All right. And now I'm going to test your soft sense. So this is going to be soft. I just want you to feel it. Okay, so close your eyes and tell me where you're feeling this soft sense, okay?
My hand. My left
arm, chest, left forehead, left leg, right foot.
Okay, good. And now I'm going to touch the sharp and dull senses. So this is going to be sharp, and this is going to be dull. Okay. So I just want you to tell me if you're feeling a sharp or a dull. Okay. Close your eyes.
Dull, sharp, dull, dull, sharp, sharp.
Okay, good. Okay. So now I'm just going to ask you to close your eyes and put your hand in this bag and tell me what's in here.
Feels like I'll watch.
Good.
It's kind of numb right here on this side.
Numb on that side. How about on the inside?
No.
Okay. How about on the fingers?
These are numb and these two are not.
These are okay,
Yes.
but these are different over here.
Yes.
Okay. Is that sharper or different than this?
Yes.
It's less?
Yes.
Okay. And here, it's less than here?
Yes.
Okay. Tell me where it changes as far as I'm coming across your palm.
Right there.
Changes and it gets sharper now and sharper all the way over to here. And tell me where it changes.
Right there.
Okay. Tell me where it changes here.
Right there.
Okay. How about over here on your arm? Tell me where it changes.
Right there.
More sharp over here? Okay. Go in this direction. Still sharp. Tell me where it changes.
Right there.
Right there.
Yeah.
And it's less sharp over here?
Yes.
Okay. Let's turn your hand over here. And again, it's sharp here.
Yes.
Tell me where it changes.
Right there.
Right there. And again, tell me where it changes.
Right there.
Right there. Okay. And up here.
Same.
Same all the way around?
Yes.
So you feel all the way around okay up here?
Yes.
And into here, it's okay?
Yes.
Just your finger, and you can just, this would be light touch. Light touch, and then just pressure, and what you would say to the person is, I'm going to ask you to tell me if something feels light or a deep pressure to you. And this would be light, okay? And then this would be deep, okay?
Where do you apply pressure?
What you're going to do is you're going to check the whole arm. It all depends. If you want to look at like peripheral nerves, then you're going to look at specific areas. If you're looking at a stroke or a head injury, you're doing more diffuse. Okay? And what you want to do is determine the area that you want to test. And then you would either stroke it, like either with this, or I think did I have you bring cotton balls?
Yes.
You can use the cotton ball and then your finger, or you can use a cotton ball and the eraser of a pen or pencil, or the end of it, or you can just use light touch with your finger and then deep pressure. And what you're doing is you're going over different areas of the extremity, and they're identifying whether it feels light or deep to them.
You would obviously have the vision.
And the vision is occluded, right? Because otherwise they're going to be able to identify. So I would ask, does it feel light? Light. Okay. And ideal, if you want to make sure it's not, because they have a 50-50 chance with some of these, like sharp, dull, hot, cold, light touch, deep pressure, they have a 50-50 chance of getting it right just by guessing. So to make sure, you can do 2 or 3 in the one area, and then you're going to progress to the next area. So if it's a CVA or a head injury, you're going to do diffuse. If you're looking at peripheral nerves, then you're going to look at like radial nerve and ulnar nerve and median nerve. If you're looking more centrally, like myotones, then you're going to do your, what does myotones mean? Dermatomes, what does that mean?
Specific.
So you're looking at spinal levels, 1, 2, 1, 2, 2, 3, 4, 5, 6, and where it corresponds to the portion of the skin. So you should do vision occluded, stroke, difference between light touch, which is stroking either with your finger or with like a cotton ball, and have them identify if it feels light or deep to them, okay? The same thing with the sharp dull. So what you want to do is, this one you want to be careful if you're taking your safety pin. So now sharp and dull. You want to make sure, number one, you clean your safety pin, okay? And number two, you also want to make sure that the area that you're testing is clean, so you could have them wash their extremity. Because if you're touching somebody with a sharp point of a pin, you want to make sure their skin is clean so that you're not introducing any kind of bacteria deeper, okay? So then, can I borrow your safety pin? Sure. All right. Okay. The other thing you want to be very careful of is test the safety pin yourself, because some of them are extremely sharp and you don't want to draw blood. And you have to be careful because you have to kind of learn how, put it on your own hand and see how much pressure it takes to detect the sharp, okay? And again, vision is going to be occluded. All these tests should really be done in a quiet room, so because any kind of distracting noises might interfere with the person being able to focus on the sensation. What you're going to do is, if it's a person with a head injury or a stroke, it's going to be more global. And if it's a peripheral nerve, you're going to be doing your peripheral nerve innervations, some radial nerve or median or ulnar nerve or such. And then if it's a person with a spinal cord injury, then you may be looking more, looking at the dermatome levels. So what you're going to do is the same thing. You're going to alternate. You're going to say to the person, first of all, I'm going to orient her and say, I want you to tell me if this feels sharp or dull to you. This is going to be sharp. Okay. And this is dull. Now, then what you're going to do is, depending on where you want to test, make sure you do a couple of times in each area because, again, they have a 50-50 chance of doing it just because they were able to guess. So does this feel sharp or dull?
Sharp. Sharp. Dull. Dull.
What are you using for dull?
Dull.
Pointy for sharp, the rounded piece for dull. You just
heard John saying like sharp. I was like, was it sharp? Because I could have sworn it was dull.
You got it.
No, because he said
Oh,
the opposite, and I thought he was talking.
So you're going between the pointy sharp piece and the dull, this portion, the head here. You're alternating, going between it. Don't do a pattern, but if I'm looking at ulnar nerve, I'm going to be looking at this distribution. If I'm looking at median nerve, I'm looking in this distribution. If I'm looking CVA is someone with head injury, then I'm looking more globally. And you have some people, have you talked about neglect with strokes? You have some people, it's the perception of the stimulus, it's not the sensory tracts. So there are people who have intact sensory tracts who have neglect of an extremity. I could poke them and draw blood, and they will not detect it. So you have to just be careful of how hard you're poking somebody. And like I said, CVAs and head injuries tend to be more global, okay? And then mild dermatome, spinal cord injury, or peripheral nerve injuries, there's a very specific area of the skin you're testing. So that would be a sharp dull, and then you have light touch and deep pressure.
Good evening, Mr. Null. I'm James Packman, a student physical therapist at the University of Illinois. How are you doing today? Good? All right. So today we're going to test your sensation with light touch and sharp dull. I understand that your right side is having some deficits in sensation. So first off, we're going to test your good leg, which is your left, and we're going to use this as your light touch, and we're going to use this as your sharp and dull. So to test out, we're going to expose your leg here, and just so you know, this is going to be the light touch. Is that good? This is going to be your sharp. This is going to be your dull. Okay. Okay. So for testing your involved side, you're going to have your eyes closed. And what I'm going to do is, for the light touch, I'm going to touch you in 4 different areas on your leg, and I want you to tell me where they are. Okay? So, legs, close Close your eyes.
Test it like this, so you can do flexion really fast and extension.
Oh yeah, this is nothing. Literally, and then ankle is just down.
And you can test it all and then that.
Open your eyes. Okay, so now we're going to do your sharp touch and the dull touch. So the same thing. I'm going to touch you 4 times in 4 different areas, and I want you to let me know if you feel it's sharp or dull. Okay. Okay. So close your eyes. Sharp. 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 Dull. Okay. Dull. Dull. Sharp. Dull. Sharp. Sharp.
I don't know if
Dull.
you would even need that case.
Sharp.
Yeah.
This one.
Oh yeah.
Sharp.
Well then I guess just not.
Dull. Sharp.
Oh yeah.
Sharp. Okay. So there seems to be some discrepancies on your right side. So we're going to see what's causing the problem with that. And from there.
Okay, the first thing I want you to do is tell me which side I'm touching. So close your eyes.
Both. Left.
Okay, what does this feel like?
Cold. Cold.
All right, turn your hands over. What number am I drawing?
3. 6.
Good. And what do you feel now?
Vibration, a buzz.
And now?
Vibration.
Okay. Okay, I'm going to ask you when I touch one side or both.
Yeah.
Okay, close your eyes.
Right. Both.
Very good. I want you to tell me which is warmer, which is colder. The first one or the second. Here's the first, here's the second.
Second.
Is colder.
Second.
Let's do that again.
Okay.
I want you to tell me which one is colder, the first or the second. Close your eyes.
Okay.
The first or the second?
First one is colder.
The first one or the second?
Second one is colder.
If you had trouble, I would just, you tell me when you start feeling it as I come up your leg, and that gives a good indication. Now close your eyes. Do you feel anything here? What do you feel?
A buzz.
And now?
A buzz. It's gone.
Okay.
I'm going to test the sensation in your legs now. Okay. So I'm going to start off by using this piece of, this wisp of cotton wool. Okay, so it's going to feel like this. Can you feel that?
Yes.
Good. So I want you to say yes when you can feel it in your legs, and I want you to close your eyes for this, okay?
Okay. Yes. 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 Yes.
Did that feel the same on both sides?
Yes, it did.
Okay. Now I'm going to test sensation with a pin. It's going to feel sharp, but it won't pierce the skin, okay?
Alright.
So it's going to feel like this. Can you feel that?
Yes.
Okay, now I want you to close your eyes, and I want you to say yes when you can feel it on your legs.
Okay. Yes. 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 Yes.
So I'm going to test the vibration sensation in your legs now. I'm going to use this tuning fork.
Okay.
So it's going to feel like this. Can you feel that vibrating?
Yes, I can.
Okay, that's fine. So I'm going to test that vibration sensation in your legs. I want you to say yes when you can feel it vibrating. Now if you just close your eyes for me.
Yes.
And tell me when it stops.
Stopped.
Good. Okay. And the same again. Tell me when you can feel it vibrating.
Yes.
And tell me when you feel the vibration stop.
Stopped.